Hello, I'm Philip Johnson. I'm a patient coordinator here at Sponaugle Wellness. We're very excited to do what we're doing right now. We call these kind of our exit videos. These are about showing you patients that have come here to our facility. They have been treated. They have great stories to tell, not only of what they were going through before they came here, but on these exit days, we get to see the other side after we've been treated. And for us that are sitting in here, this is going to be on our website, and people from all over the world are going to be able to view it. So this is our, we use our Hollywood smiles today, our parade handshakes. So when people watch this later, they'll be able to enjoy that. So we just want to be relaxed, speak as loud as we can in a normal voice. So when you folks are watching this miles and miles away, you'll be able to hear what we're talking about. And this is Yvonne, and this is Kamea. And we met them on the phone, first of all.
Yes.
You folks came to us from Canada. And for those folks that are in Canada, we know that you sometimes have difficulty being treated for Lyme, and not many options for you. And so we do get a lot of Canadian patients to come here, and love having them come down. And so we started talking on the phone, and you began to explain conditions and what we were dealing with. And I don't remember how long that took, but we probably bounced that around 3 or 4 weeks, I suppose.
Yes.
And working on making arrangements to come down. And so your journey here started with us 10 weeks ago, is that correct?
Yes.
Okay. All righty. So here's what I want you guys to do. Let's first talk about Kamea. When did you start it? Because I understand, talking to your mother, that you were a gymnastic. You had so many great things going on in your life, and something just started taking that away from you. So when did that start?
When I was in grade 5, around Christmas, I got a fever, and then I got really fatigued, and I just couldn't do anything, and I was sleeping in class, and I was sleeping 12 hours a day, and I just couldn't get enough, I couldn't stay awake. And
there's that, classic what we call the flu-like symptoms. You maybe don't know why you're even feeling this way. We just feel like you're getting the flu. So that was 5th grade. We didn't ask how old you were. Now, normally we don't ask women how old they are. We're hoping you don't take offense to that. So how old are you now?
I'm 14.
14. So
it was 3.5 years ago when she got sick.
Okay.
Yeah.
And was that a sudden fall away? Was that a gradual?
It was pretty sudden, I think. But the symptoms started getting really bad last year.
Okay.
And because it started off after I would do 4 hours of training at gymnastics, I would come home and my joints and my, below my waist, my knees, my ankles, they would just ache and pain, and it would just jump and everywhere pretty much, and it was more of my left side that was more affected.
Okay.
And it kept getting worse, and more fatigued, and I felt like I couldn't do gymnastics because I didn't have the strength that I did before.
Okay.
So I quit in the year later, around
2.5 years ago she quit.
Yeah,
Okay.
so grade 6 I had to quit.
Well, I'm very uncoordinated, so gymnastics seem dangerous when you're a peak performer, when everything is perfect. So when you speak about starting to have joint pain and trouble, maybe even balancing, or obviously if you're having weakness in one side, you're going to get off balance fairly easy. So I imagine Mom watching on probably caught her breath a few times.
Yes, it was not fun.
So what did you do? Did you go to a doctor? Did you just try to press through it? What happened?
Yeah, the first, I went to school with the fever the first day, and I came home and I slept the whole night. So then the next day, I think, or a few days after, we went to our pediatrician,
Okay.
and he looked in my throat, and he said, that's strep throat.
Okay.
No swab, just put me on antibiotics for a few days.
It's a great doctor that can do that.
She didn't have a sore throat, though. That was the
I
issue.
know, I'm just teasing,
That's
of course.
the bad thing, yeah. She didn't
Yeah.
have a sore throat, but it seemed to be strep.
Okay,
And then the antibiotics for 6-7
I
days.
felt the same.
for the strep, antibiotic for strep
Yeah,
throat.
she never got any better. So
Okay,
I took her back, more blood work, and then it was just, her blood work's all normal, and he says there's nothing wrong with her. Do you think she's stressed?
okay.
Or depressed?
Stressed or
Sorry,
depressed.
depressed. And I'm like, no, it started with a fever. You said she had strep throat. There's something seriously wrong with her.
Okay.
Yeah.
Now, again, the Canadian health system would not look for Lyme.
No.
And not only the Canadian, in the United States, most doctors are not going to look that way.
No.
And what made you finally suspect that Lyme might be involved? What brought you that direction?
I kept researching.
Okay.
I kept researching, and basically she was diagnosed with migratory polyarthritis. She was diagnosed with chronic pain syndrome for her joint pain,
Okay.
and vasovagal syncope for her fainting.
Don't
And
say that 3 times fast.
Yeah, and then I'm sitting here going, well, it doesn't make sense that a kid that has no symptoms, has a fever, then has all these symptoms, but they all mean something different.
Yeah.
And in my world, that doesn't make sense. So
Okay.
I kept researching, and all I came up with was either she had this rare disease, periodic paralysis
Okay.
was one because she was in the hospital paralyzed,
My goodness.
and or a neuromuscular kind of autoimmune disease,
Okay.
or Lyme. And I asked 2 physicians to test for Lyme, and the first one said she didn't have enough neurological symptoms to warrant testing for it, and the other physician said, when do you stop asking for all these crazy tests?
Oh my.
So we went to a naturopath, and the naturopath ordered a kit from Igenics, and
Okay.
that's how we got our testing.
All right.
But then you take that to the infectious disease doctor, and he says, I don't believe these results. It's a for-profit lab in the U.S. It's not government funded.
Oh. So they're just trying to lead you astray, in that direction.
Yeah. And then they did the Canadian testing, which was negative, and he said, see, she doesn't have Lyme.
Okay. And many of the folks that are watching have probably experienced similar situations
Yes.
of not recognizing that Lyme is a possible cause for all that's going on here. And when we go back and think about this, were you able to go back in your mind and say, yeah, I got bit by a tick or a mosquito, or I remember when this started? You can't trace that back, can you?
No, we did, I did play outside a lot, and we had a cottage. We probably went to the cottage, but we never saw anything. Of course, everyone gets bit by mosquitoes, but
Mhm.
you don't notice, I never saw a bullseye rash or anything, so.
And so, if it's okay, and if you want to add to this, you discovered some things once you came here about where this may have came from.
Yes.
Yeah.
Is that something we want to talk about, or?
Sure.
Okay.
Yeah.
Ultimately, through all her testing, the doctors felt that there's no way that Kamea just got this 2.5 years ago.
Okay.
She could have got bit 2.5 years ago and it set it off, but based on her genetics and everything that's going on, she likely had it since birth to be
Okay.
as bad as she is. And
So if it came through birth, we have to go back to you.
yeah, and Dr. Crozier and Dr. Sponaugle think that I gave it to her, and I
Okay.
sit there and say, I don't have Lyme disease. So I asked to be tested just to make sure, and it came back positive. My Western blot was positive for Lyme, and I'm shocked. But then there are symptoms that I've had my whole life that I could say, yeah, it makes sense.
Makes
now.
sense now when you
It
think
makes
about
sense
it.
now,
Yeah.
but I was still able to fight it where her body wasn't, and that's the hard part.
And our medical doctors, if they were here, they would begin to talk about that. You and I just briefly mentioned this, that genetics, your overall volume of the infection, other things play a part. How well you keep your immune system optimized, of whether you go down quickly from Lyme, or whether you're able to keep it subdued much of your life. And for many of our patients, something happens. They may have had Lyme for years and were able to basically live a pretty symptom-free life. But something happens, whether it's a surgery. I've heard people talk, it started after I went to the dentist, and something,
I've heard that too.
something about, what happened while I was at the dentist caused this to happen. I'm not trying to say it was the dentist's fault. It caused a reaction in the immune system. I had a surgery. Some say it started with an emotional event that I went through. And we know that an emotional event, a tragic emotional event, an excessive emotional event can cause your immune system to become compromised. For many of our patients, it's the mold gene.
Yes.
They get exposed to mold. And the mold is the straw that breaks the camel's back, so to speak, and allows the immune system then to become compromised, and that Lyme and Bartonella and Babesia, all of these things begin to almost as a disease of opportunity. They find the weak link and go that way. So, so from the time when you first got sick until you came here, several years passed. You mentioned once you were in the hospital. Did you get treatment continually through that period of time?
No, they didn't even treat me. Like, they said, like, I couldn't move both my legs or my left arm because my left side was always worse, right?
And was paralyzed at the time
like,
she was admitted to the hospital.
I would barely move my fingers even, and they said, well, we'll test you for the periodic paralysis, but that's really rare, so it's just stress. So they sent, we had
a team of people treating her for stress.
Okay,
so there was
for stress.
Three doctors, like
a pediatrician, a social worker, and a physiotherapist, and you would go every 2 weeks to one of them, and every month to the other. They would take her vitals and say, everything's fine. This hasn't happened again.
And it's not like, if they say it's stress, how do you treat stress? You can't.
Well, I was going to ask you, were they offering you drugs to,
No.
deal with your emotion, depression, stress? Okay.
They always, and when the social worker, she
Here
always,
we go. Here, you're getting warmed up now. Let's go.
she always asked me, like, how are you feeling today? And she always, she always talked to me like that. I'm like, I'm not, like, a little kid. Like, seriously. It's like, and she didn't do anything. Like, they just wrote down stuff. And it's like, how are you treating me? What is the point in this?
Yeah.
So we eventually just said, like, I don't want to go anymore. They're not helping me.
Sure.
There's no point. Like, so.
And they still only looked at that one symptom, being weakness and paralysis. They wouldn't look at her other symptoms at all.
All right.
And it didn't make sense. And the social worker basically said that they don't look at what's causing her to be paralyzed or weak.
Okay.
Yeah.
They try to find ways to cope when it happens.
Oh,
And that's
I
how
see.
mentally you have to have a positive thought.
All right.
So in the
It's
end,
pain management in the end.
yeah, it's not going to do anything when you don't find a reason.
Well, this is important. Your story is important, I think, to everybody that's going to be watching this. First, Lyme does not have a conscience. It's not going to just choose a particular group of people. And you being a child, when you started experiencing this, it's a tragedy. But we know that this can strike anyone.
Okay.
And many people, our doctors believe that many people have Lyme today, are carrying it around, and usually because their immune system is still pretty good, they haven't seen the symptoms. But you being as young as you were, of course, it pulled all of us into this story. We all, love children, and I don't want to say child. You're a maturing woman, teenager now, and but we do treat. We do treat children here, teenagers under the age of 18, and because the symptoms can be just as frightening and devastating for you. We all thought in the youth we could conquer all, but some things are just stronger than we are and compromise us. So we talked, as we said, we talked on the phone. We got you a start date. We arranged for some tests to be done. We always try to do pre-testing when we can. For some of our Canadian patients or international patients, that's a little more difficult to do. You got customs that are involved, and for our Canadian folks, we try to use laboratories in Canada that can move that around within to get the blood work that we need to do and some of the urine tests that we need to do. So anyhow, we build that biochemical blueprint. When you see our doctors, it's like seeing 10 specialists in one room.
Oh, yeah.
And we're able to just connect all the dots. We literally look at over 600 biomarkers, and that's so important because that's the discovery. It is forensic medical science is what we're doing. We're trying to discover the cause. We're not interested in treating symptoms. We want to find the cause of this problem. Mm-hmm. Why are you hurting? What's this paralysis about? Why is a strong young woman that was competing in gymnastic, how do you go down? And so it is a forensic science, and they're very, very good at that, and the discovery part is absolutely fascinating. We never just treat Lyme. We didn't talk about that with you, but did testing reveal more than Lyme? Was there these co-infections we talk about? Was any of that involved?
I was positive for Babesia,
Okay.
but not Bartonella. But when we went to the Lyme literate doctor in Plattsburgh, we found out, she asked if I had any symptoms of Bartonella, but I just have a rash on my arms, and we didn't know what it was caused
Okay.
from. So she said, well, we don't want to, we just want to make sure, so she treated that for a bit.
Okay. Just kind of covered it in case it was there.
Just,
All
in
right.
case.
But finding the mold here was the shocker. I didn't know mold
Yeah.
was an issue in anyone's life, and to come here, I think mold played a huge part in her.
And finally compromising her whole
Health,
immune system.
yes, yeah.
That was it. And we can't, for those of you that are listening in, we do genetic testing for all of our patients to discover whether you genetically can process these environmental poisonings such as mold or benzene, whether your body does a pretty good job of getting that out. And our doctors would say that at least 1 in 4 people have the bad genetics, and when you get exposed to mold, your body can't do anything with it, and so it just begins to create all kinds of issues. And you fit one of those profiles. If we were trying to profile people just by looking, which is not what we do, by the way, but if you were trying to look at people and profile them, then the light skin, your eyes are, greenish almost, right? Today, or do they change colors at times?
They change,
All right.
yeah.
So are they ever blue, or are they like gray? Okay.
There are a whole bunch of different colors.
All right.
Yeah.
Well, light-skinned people, lighter colored eyes, lighter colored hair, even with the red. Some, certainly some of the European backgrounds, those people are usually, if you were just visually looking, often are the ones that show that their genetics are poor when it comes to mold.
Yep.
And yesterday I met with one of the great mold remediators here in the United States, and we actually did a video yesterday. We'll be posting that on our website soon to help people answer or understand mold and how it works, and how can mold be treated in your home, not about how we treat it with, once you've ingested it, but it is it's a frightening scenario of what mold can do and how it compromises our health so much. And government standards, I believe, I've heard several numbers, but somewhere in the neighborhood of 50% of every building that's standing is a toxic home. So for folks that genetically cannot deal with this, they kind of have to be on guard, wherever you go. And which brings me to another point. When our patients come in here and we're able to get the mold out, it's fantastic that we're able to do that, and we can prove that, medically. We have numbers to show that here was your mold numbers when you came in, and here they are now. But we don't leave you defenseless. We have an exit strategy. We have supplements that will keep your body detoxing mold in case you were re-exposed or go back into a moldy environment. So, we're boring you to death. You started to yawn. I was the one that told you this morning that I was tired.
Yeah.
It was at midnight when I went to bed, and those few hours I got to sleep. And then maybe the weather, that it's raining. We're all getting sleepy today.
That's right.
Maybe we could schedule a nap. We'll just pause this for a little bit. So let's talk about what happened here. Let's talk about a wheelchair. I think
Yeah.
you got used to that for a while, huh?
Yeah, like in the summer of 2012, yeah, we bought a wheelchair because I just couldn't make it every day. Like, it was just too hard to walk. So
Okay.
I go to school like maybe 2 to 3 days a week in a wheelchair, or staying home sleeping, or just like trying to catch up. Like, it was hard. So then when we came here, it was because we drove down here, so the car, I get nauseous a lot, so that just made all my symptoms really bad. So the first day I wasn't walking well, I was sleeping all the time. Like, I brought my Winnie the Pooh blanket in the waiting room,
Yeah.
and yeah, it was just, I had to take so many gravels that those made me even more tired. So yeah.
We would see you out there, you would be hooked up to your healing IV drip and your blanket, and I often commented you'd just be all bundled up. I said I could pick you up and put you in a grocery bag and carry you around.
That's right.
And
And then during the kill phase, when they were breaking up all the bacteria and getting it out of her body, she got worse and was in the chair for about a week.
now, let's talk about that a minute. I'd like you to share that, because one of the things we do is try to educate our people while they're here. We have seminars on Mondays, of course, every visit with the nurse and the doctor. So you mentioned that during the kill week. In your words, tell us a little bit about what a kill week is and why she might have been hurting. Can you do that a little bit?
I can a little bit.
Well, yeah, I think it'll be great.
Yeah, they use vitamin C IV, or hydrogen peroxide, and it's breaking up the biofilm that holds a lot of the bacteria in and the mold. And once they break through that, it's released into your body. The toxins cause more symptoms because you can't get them out as quickly as they're being created. And that is why she got worse at that time. And then once she's done killing, then they detox more of it out of you. So then once you're getting the toxins out, your body's starting to heal on its own, then you start to feel a bit better.
So there's going to be, no matter who
No matter
you are,
who's here.
no matter who you are, what you're going to have, when we start killing bugs, this is where people, will I hurt? Will I have that Herxheimer effect?
Herxheimer reaction, yeah.
We're very good at, let's use the word masking. Maybe that's not, but masking that pain. We're very good at minimizing any of those symptoms. And we tell others, when you're feeling that way, that's a good thing. It's a sign that we're getting rid of all those nasty things. But it does supercharge, you over-electrifies those bad enzymes, bacterias are moving around, and you hurt a little bit.
Yeah.
So it's not something that you can't, but in your case, because you came in on a wheelchair, I've seen you several times back in that wheelchair.
Yeah.
During that time, and because it was a pain, or was it joint pain again? Was it just discomfort to walk at that time?
No, I don't normally get a lot of pain when I'm weak, per se, but when I do more activity, or I walk a bit more when I'm feeling better, and I do too much, that's when I
Get the pain.
get the pain a bit. But when I'm weak, it's just weakness. Like, it's just so, like, my weakness is different each time too. Like, sometimes it will be
A balance issue.
yeah.
Okay.
Sometimes it's just like takes so much energy to just lift my one leg, or sometimes it's just like my legs just won't go, or they're just so weak. Like, I can walk weak, like I can walk slow, but it's easier, but it's different every time. So
You were doing kind of like the monster mummy walk once in a while through here, that slow walk.
Yeah.
Reminded me of them old black and white mummy shows I used to watch when I was a boy, and I could see you were thinking a lot about each step. Really
It was
planning.
a process that, it wasn't going to move on its own.
Yeah.
But what I find good about this treatment is that she went through treatment prior to coming here for 6 months, and ultimately I never saw her get out of a Herxheimer reaction.
Okay.
She felt horrible the entire time, and ultimately now, knowing what we know now, that she has both genes, that she can't clear mold toxins or Lyme toxins, that she would never have gotten better just with antibiotics.
That's so important that you talked about that.
Because she can never get it out of her system on her own. So coming here, the way that they do it, taking the toxins out, it allows her to heal.
Right.
And it makes sense.
And you did mention vitamin C drips and you mentioned hydrogen peroxide. So let me elaborate on that just a minute, because these are not all created equal. And,
No.
you know, I talk to patients that say, well, I've tried an IV drip at another doctor. And when we have the opportunity to explore that with them, we find out, I like to use, and because I'm part hillbilly, I like to say it's like their drips are like Kool-Aid and ours are like moonshine. They're not the same drips at all.
No.
And plus, there's what folks watching this don't understand is that this is a complicated science. And anybody that just goes to someone and says, give me an IV drip, you're asking for trouble, because you don't know what you're going to do. You don't know what problems you may be unloosing, you know. So there's a lot that goes into it. We can say you got an IV drip, but that is just a small part of the story.
Yeah, I don't know what's in it, but I know it's working. I know that little one ingredient.
Well, it's a proprietary blend,
Yes,
years
yes.
of research. Our doctors, it's incredible. You know, of course, this started, Dr. Sponaugle would go back to his own daughter and how she became victim to Lyme, and him and his wife, the research they put in to create this proprietary blend. And it's part of what we do here, but that's the part. That's what I want viewers to understand, that's just a part of what we do here. It's the science of understanding this all. And so we're going to treat not only with the healing IV drips, you know, we use the finest natural supplements as well, because there's a lot of things that need to go on. We're never just trying to, we just didn't try to kill your Lyme. Yeah. We know with all of our patients, Lyme has compromised. We already know the body's been compromised. We already know by treating hundreds and thousands of patients that when you come in here, you know, there's a host of things that are wrong, and so we want to get all of that right. We need to get all of that right so that your own body is now your greatest support in getting you well. We're going to optimize that immune system. We're going to, we're going to look at hormones. We're going to look at thyroid. We're going to look at brain chemistry. We got to get everything working together to get you well. And this is why, of course, this won't work with you. This is why when I say to people, when you look on our website and some of our people look like they're 10 years younger because they got the wellness protocol, and they do, we can't use that with you. You're already young, and you know, you and your mother are beautiful. You look like the perfect people of health. It's just incredible. And but it's because we just try to heal on so many levels while we're here. And so you had that kill week. That was, let's tell folks, you know, somebody may be saying, the kill week, Hertzheimer, I don't, you know, they're scared to death. What would you say to those people about that? I mean, you went through it. Can they go through it? Is there something you want to say to them about those kill weeks?
Yeah, I don't know. I just took like the andrographis, took like the 3 and 3 because I just wanted to get everything out. Like
you were, I gotta see. So you were like,
she was the diehard.
You're like the one that says,
just everything.
Yeah, just I'm a man. Let's go through this. Let's get this done.
You know you're gonna feel bad for a period of time, so feel bad. That's it.
Get it past you.
Get it past, move on, and get out of it.
It's fun because for many of our patients, they've been robbed of so much already. Their life is miserable. And when I tell them the kill week, you may hurt a little bit, they're going to say, no, I don't care about that. This has robbed so much from me. I hurt so bad all the time. And so again, back to that. I don't want no one to be afraid of that. We're very, very good during that. We don't expect any issues. And
she was here a whole day once because her back spasmed so bad she couldn't even get through one IV. And they were wonderful, you know, pain meds, monitoring her, and they wouldn't let her go when she was that bad. So, you know, you don't have that anywhere else, honestly.
Oh, I know.
You don't. So I look at it and think it was the best care possible. And watching her suffer all those years, and now to see her like this, and I'm going to cry because I always cry, it's amazing. It's amazing to see the life back in her.
It is amazing. It is. I don't even want to say it because I'm a man, but I've had goosebumps several times in this conversation because this is so exciting.
Yeah.
And, you know I'm a pastor of a church, and so these kind of stories, it's what we live for. You know, it truly is. It's overwhelming. I'm sorry. Don't look at me. thought
Brought
of
you
what,
to tears.
the thought of where, that, and people that have seen me before, I dealt with Lyme for 12 years and went undiagnosed all that time. And I can't imagine what my future was going to be. I knew how far my health had gone. And so when I think about that for you, and that you have beat this, that you've turned this corner, and it's just special for all of us and for you, and
Yes.
because we discovered things about you, and
Yeah.
and so I tell people all the time, you're going to find out more about yourself here than you would if you went to 20 other doctors.
Because they're looking at your entire body.
Entire
not just
body.
the Lyme. It's
Yeah.
everything.
We don't have this tunnel vision where we're just going to narrow in on one thing. And that, again, we do that because, and I hope our doctors, when they review this, they say, oh, I wish he would have just not talked about this. But our doctors are just so good about seeing the big picture.
Yes.
And understanding that everything is a mechanism to something else in our body.